point of HiNZ this year is to really bring people together, and the health sector has got such a diverse audience that unless we are all collaborating and meeting and actually knowing each other, then barriers pop up. And it's very easy to see something as a barrier when you don't know the person. But if you've had a chance to meet them, talk with them, and realise that we actually all have the same problems that we're trying to solve, then magically it all seems more solvable. And that's some of the things that we've been delighted to see happening here over the last few days. What we're really delighted about this year is that the makeup of the audience has significantly broadened from what it has been in previous years. HiNZ traditionally in the past has at times focused very heavily on the technology and IT sector, and we've made a real effort this year to broaden it, to have many more clinicians and many more health managers, people in allied health from across the health sector, and that is I think evidenced by the pie chart I put up on the first day. You can see extremely diverse audience here today, and a lot of people have met who would never otherwise meet because they don't work in the same building, they don't work in the same department. There's no other conference that would bring them together like the HiNZ conference does.
Look, I'm really excited because we really worked hard to get informatics and professionalism on the agenda for this year, and I can sense that people are enjoying the presentations and definitely challenging them to think more about the depth of informatics and what they need to do when they go back to their day job and next Monday. So I'm very excited. Great energy, but at a different level of maturity, and we've got to continue to go up the maturity curve.
So what about the exhibitors and sponsors of the program?
Yeah, well, they all seem pretty happy, which is great, and the reason that they're happy is because they've been having some really good, deep, engaged conversations with people who are at the coalface of these changes.
It's great to see the numbers in the attendance and also to see how things have moved on. Conversations are much more advanced of what they've been in the past, and seeing those conversations being reflected back that we've been talking about for several years, it's been an exciting time.
We're talking about critical networks because at the end of the day now in health, it's how we all work together, be it that you're a GP or a district health board. Nothing is more important than connectivity and reliable, fast connectivity. And Snap's focus is very much that we enable people to live and work connected. This year at HiNZ we are just blown away by the attendees. From last year I was a delegate and learnt an awful lot, and this year to see the great minds that are coming together, we're really proud to be part of it.
And for us, it's really nice to connect with our customers that we obviously deal with every day, and obviously give something back to the customers that we deal with across New Zealand, and hear what innovation that they're bringing to the table, and obviously celebrate that success. So that we've got a number of areas that we're really focusing on, and one of those is really clearly mobility. So we see now, if we've got these tablets out here, really talking about how to replace what could be a big clunky laptop and a tablet down into one easy to manage device.
So Orion Health are gold sponsors this year. We have been talking about our 3 solution groups: healthier populations, smarter hospitals and intelligent integration, and we've been showcasing our products through our demonstration screens. We've had a lot of different people come, from delegates, CIOs wanting to find out more about how products specifically work, to other exhibitors wanting to partner with us, so we've had quite a few of those as well, and also students coming to try and find internships. So we've had a whole range of people come to the stand, and it's been very interesting.
We're an IT distributor, so we sort of work in the background with the likes of end users and resellers and provide hardware. Okay. We don't do the software part, we leave that to the IT integrators. While it's a new market for us, we've always had the product to support the healthcare market.
They're really wanting to discuss these issues with the end users, people who will be using or implementing or leading the change of driving the future of the health sector. And so that's why it's working for them, because they're getting to talk to those people, they're getting to have those deep cross-functional conversations. We've got great plans for next year. We want to take the level of engagement and interaction to another whole level, and we've got some great plans underway already behind the scenes, where we're going to be looking at mixing it up a bit, more field trips, site visits, and we also want to do more interactive sessions, small group, round table, deep engaged conversations as well as the fantastic keynotes and other presentations. So we're really excited. It's in Christchurch, and it's the first time that we have taken the HiNZ conference to Christchurch. They've now done enough rebuilding that we have a venue, and in fact we've secured 2 hotels because we know there'll be so many people coming down, we'll need more accommodation. The venue is going to be Wigram Air Force Museum, which is great. So we're going to be having the gala dinner surrounded by a whole lot of vintage planes, and it's got a very spacious venue. It's going to be a fantastic exhibition hall and a really nice plenary setup. 19th to the 22nd of October 2015, so we've done our best to avoid any school holidays, any public holidays. We're not over the top of Canterbury Race Day, which we are this year, so we're going to make it a lot easier for people. So look for HiNZ next year to take it to that next step and to really get an even deeper level of engagement than we've been able to deliver this year.